So, good afternoon to all. Welcome you all for the afternoon session. I cordially welcome our keynote speaker, Dr. T.S. Satyanarayana Rao, Honorary General Secretary, Indian Psychiatric Society, for the induction program. I welcome you, sir. I welcome deans, HODs, staffs of various departments and students to this induction program. I welcome you all. I request Soumya K, Assistant Professor, Department of Mathematics, to introduce our speaker, Dr. T.S. Satyanarayana Rao, sir, to the gathering. Over to you, Soumya ma'am.
Thank you, ma'am. Good afternoon, all. It's my immense pleasure to introduce today's guest of this session, Dr. T.S. Satyanarayana Rao. Sir is the Honorable General Secretary in Indian Psychiatric Society, Editor of Journal of Psychosexual Health, former editor of Indian Journal of Psychiatry, professor in the Department of Psychiatry, Jesus University, Jesus Medical College, Mysore. Sir served as consultant psychiatrist and sexologist. Sir completed their MBBS at Davanagere in the year 1978. Also, Sir is the best outgoing student and the gold medalist. Sir completed their DPM in the College CM, Vellore at in the year 1982. MD, they got MD degree in CMC at Vellore in the year 1983. Sir got their postgraduate diploma in hospital administration in the College CM at Vellore and Tulane University, USA. Sir is past president of Indian Psychiatric Society, Karnataka State Branch, 1999 to 2000. Currently, president of Karnataka Sexual Academy since 5 years. Also, the president of Indian Association of Mental Health 2015 to 2017. Sir is a member of Family Studies and Interventions in WPA. Also, member of Positive Psychiatry Session in WPA. Sir is a chief advisor of Journal of Geriatric Mental Health. Sir is also editorial board member of SARC Journal of Psychiatry. Sir is a member of various organizations such as World Association of Sexology, Oceania Federation of Sexology, Fellow in Council on Sex Education and Parenthood International, and so on. Also, Executive Council member of Council on Sex Education and Parenthood International, South Asian Society for Sexual Medicines. Sir has published more than 302 research and review papers plus 26 books. So important publications is Dampatya Vaidya Shastra in Kannada. Sir has edited 5 major reference books such as Indian Mental Concept First, released at ANCIPS 2013 at Bangalore. Art of Psychiatry, Relationship Matters, published by IAPP July 2011, and so on. So, Sir has attended more than 48 international programs in different countries since 10 years. The last visit is to Bangkok, Indonesia, to train psychiatrists from Indonesia from 18 to 22nd January 2018. Sir has got more than 20 orations and awards, few among IAPP Varanasi International Award for Research, November 2008, Asian Award in the year 2009, Special Award for the most popular book in science, Kannada, from Karnataka Vaidya Sahitya Parishad, Bangalore, December 2009. V.N. Bagadia Lifetime Achievement Award from Bombay Psychiatric Society at Mumbai, 23rd April 2017. Eminent Psychiatrist Award 2017 at KANCIPS 2017 at Hampi on 1st September 2017. World Healthcare Achiever Awards 2018 for Healthcare Professional of the Year Sexologist on 19th December 2008 at Hotel Lalit at New Delhi. So D.L.N. Murthy Rao Orations Awards from Indian Psychiatric Society presented at AMCIPOS 2020 at Kolkata, the highest scientific academic award from IPS. Also, Inspiration Idol 2020 by Dr. Pachlor Foundation's Planet V, Maestro, Multi University, India on 19 July 2020. On behalf of ATME College, I cordially welcome our today's speaker, Dr. T.S. Satyanarayan Rao, to this session. So I welcoming you, sir.
Thank you very much.
Thank you, sir.
Yes, sir. Yeah.
Thank you, Soumya.
Okay, ma'am. Thank you.
Thank you, Soumya, ma'am. Now I request Dr. T.S. Satyanarayana Rao, sir, to address our students about stress management and adolescence problems. Over to you, sir.
Thank you very much. Good afternoon. Lunchtime, but I'm talking to you, and that itself may be one of the stresses. At the outset, let me thank ATME College of Engineering, Mysore, for giving this opportunity to talk to you all. Principal Dr. Basuraj, Chairman Dr. Arun, Chandrasekhar, whom I know for a length of time, and all the other part and parcel of this organizing committee. Let me thank you for this opportunity given to me. I was requested to speak on stress management and adolescent related problems. So stress management and adolescent related problems. Keeping in mind that I will be addressing a lot of students, I have tried to make it as simple as possible. And though this is a psychology, psychiatry topic, it may be quite new to quite a few of you, I'll try to convey as much as possible. That way, both from the students' point of view and from the parents and teachers' point of view, some message is conveyed actually how to go about understanding some of the things. When we talk about stress or even adolescents, always confusion will be there, and what really need to be spoken to them. Possibly you call Swamiji, he would be addressing you in a quite different fashion. Maybe another biologist or an engineer or somebody else, other professional. Each one tries to look at this problem of stress and adolescent issues in their own particular way. Ultimately, you might have noticed that this is a COVID time. All of you have been bombarded with a lot of information, and almost like our whole nervous system is getting jammed by so much of information is being provided in the virtual medium, and what to grasp, what not to grasp, how actually we have really utilized all of these things, issues may be present. When we are trying to talk about stress, we can't just neglect this whole aspect of corona, and each and every one affected one way or other. It has affected all. It has affected all aspects of our life. One of the most important issue what I can really mention here is actually too much of information. And you might have heard any TV program if you open. In fact, everybody is talking about so many aspects, and many of the visual presentations actually made are more scary than actually what one can be expected to. And one of the reasons actually being given is that don't try to listen to anything related to the COVID or whatever it is for more than 1 to 2 hours per day. Listen to what is actually given by the medical departments, maybe the government related departments or World Health Organization. Because much of the time we are getting scared and in fact landing ourselves in more significant stress than what actually may be the case. I'm not trying to tell you that you should relax on that particular aspect, but only thing is, by just getting anxious and depressed, you are not going to solve any of the problems. So the fear and anxiety are bound to be present, and almost it has affected the whole range of our psychological health and relationship. What one need to do is actually being well aware of all the aspects related to this. That way you can handle the life much better. So to start off, one may be wondering actually why you have called a psychiatrist. At the beginning of this particular pandemic itself, you might have noticed that though we are all very much concerned about lungs and other body parts, but ultimately the mental health issues which are bound to actually affect each and every one. You might have noticed the pictures of migrant workers walking and corporates and all staying back at home, and many people started working from home. That means each of those type of newer aspects actually called for a lot of adjustments and related issues. And when we come to the health, one must definitely remember it is not just mere absence of disease, but we should be able to function well. In fact, one of the concepts related is actually the wellness. Whatever capacity we have, how best optimally we can work. So the well-being, when we are trying to talk about, it includes many dimensions. One of the most important things is actually physical, which one of us will understand. But World Health Organization also mentions that the mental, social, and spiritual aspects are also extremely important. And there is another terminology called as sexual health, which may be actually one of the major common area when we are trying to talk about adolescent issues. So from that angle, I have added this one. So it is the optimum functioning of all the dimensions of our being, that means physical, mental, social, and spiritual aspects. Coming to stress, of course, one of the picture what I have depicted in the left can indicate you that this particular individual is under stress. But this is one of the most common word. For an engineer, stress means actually it may indicate some physical related phenomenon. But anybody and everybody understands this. But what actually they understand, what actually they are getting the meaning out of it may actually differ quite significantly. From that particular angle, one should get into a little more details related to that. That way, what frequently we talk about. And if you open a dictionary, the equivalent word for stress actually given amounts to roughly around 600 plus words. That means each one may be talking like quite a different fashion, and almost like the blind man trying to understand elephant. For some, it looks like a fan. For another, it looks like a pillar, and another something else. This is because each one of us is trying to look at this problem in a very different fashion. Historically speaking, in fact, the concept was very simple. A time was there when we were scared of maybe the tiger, lion, or cyclone, or something related to that volcano erupting. But as and as we progress, life started becoming quite significantly impinging our life. And when we are talking about, say, something like now COVID, or maybe February, March, April, very commonly the exams are held, and exam fever or studies related, and not being able to attend to the class and understand a lot of things. And all this such type of things actually could be one of the very significant indicators of that we are all going through stress. For any students, if we ask, you might have studied all through the year, but during the exam, you try to recollect, you find a lot of things quite difficult to grasp and understand. In the class, you want to talk to that nice, beautiful girl in your class. In fact, you start trembling and utter something else and come back. We get attracted to and attached. In fact, these are all, in fact, could be part of. And this particular age group, adolescent to, in fact, many of you are there in the college, whom to love, what to love, and in fact, the concept may in time and partner may appear and disappear. Each of these type of things can add to the difficulty. We expect too much, either from the parents, from the teachers, or from the friends. That is actually another one of the area, and that itself can lead to quite a bit of difficulty, the separation and the related things. Any loss could be actually what we basically call can be stressful. So when we are trying to understand stress, one of the classic example is given is actually that serene water is there. You throw a small stone, it produces ripples. In fact, stress is what this is actually is about. It is an hedonic state. It is a turgid state. In fact, it disturbs a lot of things. And what are actually disturbs? In fact, one of the important concepts one should understand is actually stress is present everywhere. And there is nothing like stress being absent for anybody anytime. Being alive is actually to be stressful. So few of the concepts which are actually we are very well aware of actually is that it is universally present. It is both good and bad. Anytime, anywhere, anybody can be exposed to this. In fact, what is good? You can imagine one 100-meter dash that you are waiting for, and already your respiration, breathing is going up, heart is beating faster, you are sweating. But all said and done, you ran and you have come first, and your principal calls you on the podium and presents you the prize. What it means is, this what we felt actually uncomfortable component was actually your body getting ready for doing something extraordinary, allowing you to run fast and to supply you energy and maybe oxygen and other related things. So what is actually which can keep us away? Say for example, you are sitting and reading, it is maybe uncomfortable, but you are going to get good marks and coming out with flying colors can make a whole lot of difference. So what is necessary for us and which can keep us active, energetic, that is called eustress. And something which actually we didn't expect. Say for an exam, I am feeling uncomfortable. So uncomfortable that I pack my bag and baggage, I want to go off. That is the distress. What precisely people have understood is actually it is highly individualist. What is stressful for one may not be stressful for any other person at all. Take an example, adolescent problems only. So what it is you feel right, your parents don't agree with that. What your parents feel right, in fact, you feel it is actually something restraining or problematic. So it is highly individualist. And more than anything else, in the college, you might have seen, there is a boy who has failed in 4 subjects, but he may be very happy wearing the nice t-shirt and blue jeans and going around ladies' hostel and coming back. But a girl who has scored 2 marks less than distinction, she is inside the room, not coming out, and she asks, "Mummy, give me 20 rupees," because she wants to go and commit suicide. So, same stress, how actually the individual interprets, deals with, can change. That's one of the concepts actually that this is highly individualistic. Some people are more prone for this. In fact, they can land up with quite a bit of difficulty. Being aware of that means you are actually having something to actually overcome. There are benefits to anxiety. When we say anxiety, this is actually an uncomfortable feeling what one experiences of some impending doom. Something is going to happen. See, exam is actually anxiety producing, not because of anything, but because you don't know what is going to happen. If I declare that you are all going to pass, in fact, it is not anxiety producing. If I tell you that all of you are going to fail in the exam, it is again not anxiety producing. Anxiety producing because I really don't know whether I am going to pass or fail. I really don't know whether I'm going to come first or the last. So anything which involves actually that conflict or confusion or not being clear can be source of anxiety. And what actually people found, the researchers, is that this anxiety is absolutely necessary for whatever good that is actually happening to us. When actually the anxiety is in the beginning, when small quantity, in fact, the person can do a very good job. His performance increases, his output increases. But when anxiety becomes too much, it actually gets flattened. And when anxiety is too much, in fact, it actually may come down. So this is one of the very classical example every student must be well aware of. And as a young boy or a girl, you might have heard some of your parents or somebody else's parent telling, you must go 100 out of 100. You must come first to the class. That unexpected or very high expectation, it can act like a very significant anxiety producing, and person may actually fail rather than actually perform better. In the exam, whether I'm a worthy person or not may be actually one of the very anxiety generating one, which may take a lot of the energy. Coming to stress, when we are trying to talk about, it triggers a lot of changes in our body, mind, and what people called researchers for this name as stress alarm. Earlier days, it used to be very common and simple to understand. But now, as society progressed and as we are progressing, many of the ways actually we can understand that actually a person is going through stress is what actually the whole person is telling. I don't get good sleep, I feel nervous, I get irritated, my heart keeps pounding, I'm not able to concentrate. A student may talk about, I can't remember. See, all these are silent signals that actually stress is actually impinging on your body. One can look at the picture, a disorganized table and setup itself can indicate that the individual is actually going through significant amount of stress. And people have documented that once they are under stress or that overwhelming stress, it is almost like a candle burning at both ends. That means you break down very fast. Unless support is there, you can almost look at a small stick. When it is alone, one can break it very easily. You imagine you try up near about 3 to 4 sticks together, it becomes that much more difficult. That's why the friends or the parents or teachers can make a whole lot of difference in one's life. There are actually studies done to talk about why and when actually, in fact, people experience very significant stress. What actually has been documented is more and more the decision making and psychological leverage what one gets can determine a lot of things. And this is one of the experiments in a monkey. There are 2 monkeys in the cage, and one monkey is having the switch, and electric shock will come, and one cannot be sure when the electric shock comes. But there is one monkey which is having the switch, which can stop it. When 15 days later, when they tried to analyze these 2 monkeys, one which had the switch had already developed hypertension and gastric ulcers and all. The other monkey which used to get the current, but it has no control on the situation, there was nothing major problem at all. This is one of the reasons why, see, assistant professor is paid, associate may be paid much more, principal paid is highest because they have to manage much more stress and one number of people. And this is one of the classic example how more higher you reach, more possibly the stress actually you will experience. Managing students, managing teachers, managing people in general, but all of these type of things are actually indicators of significant stress actually an individual goes through. There are multiple methods we can actually assess. One is, as a doctor, I may inquire certain symptoms and signs what it is presenting. That is one aspect of it. There are politically scales available. What is actually which is producing problem? What is actually producing maximum problem? What are actually the related things which may not one be having control on and not having control at all? So many of these type of things actually can be assessed very properly, and one can talk about it. When we are talking about stress, whether you are a medical student or an engineering student or anybody, you have to have some idea where actually people. One of the left diagram I just indicated to indicate that many people believe heart is the source for our emotions and a lot of things that are actually happening. And this is actually not true because ultimately now, just tell them not to make this. The important part which close the door. The door closed. So brain is one of the key component which actually determines all the things, and this is the one which controls each and every one of our behaviors. There is also true that people believe that one can manage with the brain and one can manage with the heart. That means these are all actually like 2 different separate components, but ultimately one may be talking about issues related to the feelings and what we talk about issues related to the cognition or the brain related functions. We have to nurture both, extremely important. This is one of the reasons why a student may score very high marks. He may be the rank holder, but may be a utter failure in the life. There is another person who may be the last student to pass with the lowest possible marks, but he may be one of the shining example of doing extremely well. And this is one of the reasons why many of these IT and other related institutions nowadays, they try to talk about managing emotions or managing feelings is one of the extremely important component that is necessary. Because as students, I am trying to talk to you, I thought there are few informations that is necessary for you to understand. How our brain functions, what is precisely happening. Of course, one of the very earliest, we are growing in the mother's womb, and at the time of delivery, approximately around 50 to 55% of our brain growth only has happened. And another about 30 to 35% of the growth happens in the first 5 years. That means what actually we do at that particular level is one of the extremely important components. I can give another way explanation for all these type of things. But see, for example, a child is very active, trying to do this, trying to do that, and trying to connect with a lot of people. That means actually in the brain, a lot of changes are happening, and nerves and the system itself producing changes. That way, it tries to connect with many of the things. Billions and billions of connections are available in our brain to do all this type of things. And when we are trying to talk about the child is immensely capable of achieving its full potential in this particular time. And jokingly, people have said one of the best way what we have learned actually to cut short the brain's extraordinary growth is by admitting the student to the classes. All these formal and such other decisions are likely to cut short our highly exploring brain and its activities to a great extent. So one should be well aware. So there is another related component. Our brain is actually something which can keep growing, and maximum it's 30, 35, what I mentioned already. Another about 10 to 12% happens up to about 17 to 18 years. Maybe from 18 years to 50, 55 years, another about the 3%, 4% less. But all said and done, our brain is highly flexible and plastic. It can keep on responding to the situations and activities. Ultimately, what is necessary is how you use your brain. More you use, more effective it becomes. Don't use it, you'll lose it. In fact, this is one of the very classical examples. And one of the best way to manage our emotions, or best way to learn life and how to manage life is the extracurricular activities, or what we call play. See, if you imagine somebody has to go and play cricket, he has to wait for his turn to bat, he has to take the opportunity when available for bowling, and sitting quietly, or out means has to come and sit immediately outside. All these things indicate how to manage our what we call failures, or what we basically call capacity to tolerate things. Many of the times, many young people nowadays, what we find immediately, straight away thinking in terms of suicide, lot many other such things, mainly because though the education was given, but they have been not taught how actually to manage actually failures or the stress. People have been taught about how to score high marks. People have not been told how to manage if you have scored less marks in the life. So this is what stress management is all about. There are no medicines available which can actually suddenly straight away, in fact, can bring about the changes. In our brain, it is actually, we call it as a 3-layered brain. There is something called as something absolutely necessary, what we have labeled it as reptilian. There is a middle red color one. This is actually limbic system. The third one is our newer brain. This red color, what we have marked there, limbic system, is actually nothing but animal brain. And we are all animals for all practical purposes. Getting angry, not tolerant, not capable of relaxing, is an actually animal behavior. Say, for example, if you give food to 2 dogs, even enough food may be there, but they still fight and eat. So once you have actually matured, you should be able to handle this type of stresses much better fashion. You might have noticed that dogs come behind barking when you are riding the scooter. It is not that it wants to ride or it wants to take your scooter, but the only thing is, this is another concept of limbic system, what is called as territoriality. And many of the times, when somebody is in love, in the particular college days, you might have noticed that you love somebody, but she loves somebody else. Double, triple, triangles and all what we talk about is related to this fact. And we are upset about certain things. You like that particular girl, but that another boy goes near her, means this fellow's blood starts boiling. This is what's called as territoriality, very classically, in fact, explained. Sex is another, the third component. That means aggression, hungers, territoriality, and what we talk about sex. These are all the limbic system related activity. In adolescent, how it actually operates, 1 minute later, I'll come back again. The newer brain, which actually makes you think and do. In fact, many of the time, limbic system tells you that she is beautiful and I should be after her. But your newer brain tells you, in fact, whether you are doing the right thing, you may get a better opportunity later, and your job is now to sit and study. All these newer decisions are made by our newer brain. There is something called as left and right. You are all engineers, supposed to be having very well developed left brain. You are left brain individuals actually. There are others like say art, drama, trance, and lot many other things. In fact, these are all the right brain functions. For a very happy life, a synthesis or synchrony between these two things are extremely important. That means you can do a better job. One may score very high but not doing well, and another person, in fact, enjoys life, appreciating a lot of things that the nature has given, this particular differentiation happens mainly because of these two differentiations. This is only just to depict that left and right, there is a very characteristic differentiation in our brain. Many of the time students come and ask, sir, I am so upset, I am not able to, because each one, everyone has a different modes of capacity to learn. There are some people called as visual learners. Men are extremely proficient in this particular point. There are others like who are auditory learners. Girls are very much high in this particular area. Kinesthetic, in fact, doing something and actually what carry out. In fact, this is again one of the extraordinary capacity. Most of the time, in fact, voice exhibit an extraordinary capacity in this. But point what I'm trying to talk about, each one of us may have all these capacities too. It all depends upon how we. See, somebody may learn very comfortably the computer-based what called virtual way of learning. There is another one who may need very definitively a classroom situation. So all these type of things. When you are trying to talk about visual learner, the man's capacity to grasp things even at a very far. That girl who is coming about a kilometer away, married or not married, this fellow can tell. But girls' vision is actually very broad and sweeping, and this is one of the differentiation actually what we need to make up. So we have different capacities, and what actually need to be told is this learning happens from the birth till our death, and each of these things may actually happen. People used to believe that you score very high marks that you are intelligent. It is Gordon who said that it is not that particular way. There are multiple components to what we call intelligence. There is a language, mathematical, musical, visual, spatial, physical, interpersonal, and intrapersonal. The engineering students are supposed to have that physical capacity extraordinarily much better fashion because your brain has been trained to. Mathematical, in fact, boys score a little higher on that. Language, in fact, girls score very much higher. In fact, their language, appears much earlier than boys. Their repertoire is actually extremely vast in this particular area. Interpersonal and intrapersonal are again two other important components. What I was trying to tell that even if somebody scores low, but can do very well, mainly because he can do very well among these two areas. When we are trying to talk about adolescents, it is very important that a lot of changes happen at that particular, apart from the brain that is actually growing. One is actually the hormones, what we talk about. Where boy wants to grow very fast, girl want to grow very fast because I can be independent and I can do. This may be one of the ideas, but all said and done, it is the hormones which will creating range of havocs in one's life. And what actually has been documented is, it is a lengthy transitional state, may last for a decade or more. And what actually, when we are trying to talk about adolescents, a lot of problems are there because that impulsiveness, mood swings, mood judgment are very characteristic of adolescent group. They can be extraordinary, in fact, capacity they have, but all said and done, this actually can interfere and they can do a lot of some things right and many things wrong, mainly because of this particular area. Because the newer brain, which is actually necessary for our very right growth, actually still to mature, and this may be one of the reasons. You all might have noticed my father doesn't agree with me, very upset about him. And maybe when you grown up, you realize that he was having actually one of the good ideas. Okay, just audit. So adolescents may be one of the extremely important age group. One has to actually take care, nurture them, and see that, in fact, they find the right path. What they can do, what teachers can help, and how parents can encourage to help them, all of them are extremely important matters. And when we are trying to talk about exams and other related, there was a day when the children used to be upset and anxious, parents used to be cool. But now the children are cool, but parents are upset because, in fact, there's so much of competition is there. And one of the very important thing, but I was having a parent who was telling, in fact, the daughter was taking things lightly, but mother was so upset that she has to be admitted and treated for certain types of problems. And online, all of you might have noticed that teachers are struggling much more than actually the students relaxing and enjoying the life it looks like. But coming to the studies, you don't want to be under stress means only that last week before exam I can study and I can manage and I have passed earlier may not work all the time. IPL and lot many other things. In fact, you have a lot of interest in that whether that can take care of may not actually necessarily be true. Sleeping, whether you can observe by osmosis the content of the subject of the book, not going to work. But what is necessary is your consistent attention and actually manage. In the same fashion, when we are going to talk about, you can't remember a lot of things because your preparation itself is bad. Some of the enemies are your fear and stress. Place where you study, how you study, you can't just sleep and stretch on the cot and then study. All of these things are actually may interfere with your preparation. Define proper goals and actually plan properly is extremely important. When I can study watching TV, absolutely not going to help you at all, mainly because our brain doesn't have that amount of extraordinary capacity. We can attend to 1 or 2 or 3 particular stimuli and one has to actually manage with that. So listening to music, maybe to some extent, all right. But watching TV and actually I study along with that, not possible. And concentration is one more thing which is likely to get affected because if you are watching TV, both internal and external interferences are plenty. Each of the scenes and each of the activity there may actually be significantly disturbed. But apart from that, sleeping adequately, having good diet, exercising properly, balancing life properly are extremely important for, in fact, studying well and doing concentration. Many students actually are stressful because I can't remember. See, there is something called as, it has to enter first registration. In fact, it has to be stored and then you can recall. So this is the whole lot of processes involved. If any problem can happen anywhere, in fact, the disturbances will be there. There is one of the old, of course, this is the old concept, Ebbing Oscar, what we talk about. It is something interesting you remember for much longer time. Something new and something, in fact, can disappear almost 80% at the end of 20 minutes. So all the things what you are trying to work out to remember things better and all of that, there are a few things what you should remember. Studying continuously for hours together, not going to end. Break them into small pieces. After reading something, relax, try to recollect. In fact, that works out much better fashion. And remember, there are multimodality aspects. You read only about 20%. You hear only about 30%. What you see about 40%. What you say 50%. What to do almost about 60%. If you want to remember a lot of things, all these components have to be brought in together and actually work. As I told you in the beginning, some people can handle stress much better fashion. Some people are not. And what actually one can expect is we become anxious because certain of our personality characteristics. We have been brought up in a very rigid way. We are very disciplined, hardworking, conscientious, very responsible. But these are the people who are highly anxious because the world doesn't match to their actually requirement and they can land up in a whole lot of things. And that's what actually we call, there are a few factors necessary. One aspect is actually early upbringing. More freedom you had, more responsibilities you had, more things you independently manage, you will work out that much more better. Constitution, by birth itself, something good or something bad. You have some hole in the heart, which is actually can be a handicap. Stresses, if it is unbearable, too much, post-traumatic stress disorder, in fact, very significant, overwhelming related issue can persist and can create problems. COVID, one of the classic examples. So, a combination of this can create havoc in one's life. And if somebody is built strongly from the beginning, by both psychological, social, plus physical, what we are talking about, he can handle stress much better fashion than another individual who have been all the time given love, affection, and that doesn't know how actually I manage the stress. More life stresses. We are all well aware too many things happen together suddenly, and in fact, more instability actually produces. So this is one more other aspect. Role of parents. Mother's role is very well documented, and this is also true that parents' role very often gets neglected, but all said and done, both the parents contribute significantly to the child's growth. If somebody is missing, this is what is called as anomalous situation, that itself adds quite a bit of stress is actually one of them. So coming to anxiety and stress, these are the things which are affecting our life. You talk about students, you talk about girls, you talk about men, you talk about any group for that matter. In fact, there are different types of stresses. The range of disorders, what we talk about, they are all related. One may talk about hypertension, that is one of them. More rigid you are, more disciplined, more anxious about, in fact, your responsibility, more likely you suffer from coronary artery disease. So this is one of the other documented things. During exam time, suddenly asthma, something like that. In fact, somebody is prone to, can suddenly become more. Getting headache, one of the very classical example related to that. Epilepsy, any of the disorders. Back pain, other things. See, low back pain is one of the very classical examples. Almost somebody around 40, 50 and all of that, they're present with back pain, and you try to evaluate, almost 95% of the individuals don't get any cause at all. This has been attributed to the fact that it is actually the stress which is producing problems. Girls, the menstrual cycle, problems related, gastrointestinal system, gastric and other things we might be speaking about, in fact, may be related to that. Fall of hair, graying of hair, in fact, attributed to the stress factors. Not eating, I'll put on weight. In fact, she may be bone thin, but all said and done, she thinks that I'm still actually. This is one of the reasons why the ladies' hostel mess bill and men's hostel mess bill would invariably be different, mainly because the significant changes what actually we see in the amount of food actually what they eat. Girls or women in particular, when put under stress, they may actually eat more. In fact, this may be one of the most important cause for actually putting on weight. And during COVID time, we are all well aware, we are in front of the computer, munching and eating, and maybe somebody else drinking. All of these things are health-wise actually potentially dangerous things. Obesity or putting on weight itself may actually be one of the more deleterious effects than anything else in this COVID time. And each and every one of us have changed, not because of anything, but because we are totally out of our regular good habits. We are sleeping at odd time, waking up at odd time, and sleep may be one of the important thing actually what one can talk about. Sexual problems, extremely common actually reported. Initially people spoke about, when now we are together and we are so happy, and this is the first time actually we are understanding each other. A little while later people started telling, we are together and I never knew he is so bad, or I never knew he is so bad, and a whole lot of other these things. So around 20-25% of the people it has helped. Around another about 50% of people it has actually produced problems. And another about 25% maybe plus minus another particular. And when we are trying to talk about adolescent problem, I thought few important even sex related issues also one we should tell. People believe that this is actually one of the areas why one should talk about. It is something natural, but absolutely it is actually learned behavior. Problems are there, almost just like this picture. Unless you watch very closely, you don't even. There may be one horse it may be looking, but if you watch very closely, there may be 5 horses who can pick it up. Sexual problems are like that. In fact, many of these young people have no way to actually talk or actually get the answers for their actually the confusion, and leading to the range of difficulties. In fact, the abortion, the pregnancies, adolescent pregnancies, many of these type of things, particularly in the Western countries. In fact, this has become one of the such a major common problem, and we are not actually much behind. And where actually we get this sex education? It is in the movies. And what is actually true, what is real, and what is actually fantasy, almost there is no way actually a person can learn. And all these type of things can be solved by actually proper sex education in the school. But unfortunately, somehow in our country, there is a whole lot of difficulty, and we are working to see that, in fact, a lot of things have changed. I am actually fair and healthy only if I have very glistening muscles like one of the celebrities. Otherwise, a young boy will think that actually I am actually in problem. My things are not grown well, and this, that, and 100 other such confusions actually may not about. In fact, just like one may be short, one may be long, one may be fatter side, one may be thin. Each of us will have very different type of endowments, and absolutely normal, and one need not have to worry. I masturbated, I get bad dreams, and that has produced a whole lot of difficulty. Many young people will have. Absolutely, there is no problem, or in fact is not likely to be difficult. Loss of semen as one of the major common area, people get worried. Almost they believe that, in fact, like a broke coconut, everything goes off, means actually there is nothing actually left, and I'm weak and tired, or 100 other such complaints what they complain is related to that. Girls also there, where my nose should have been like this, my lips should have been, in fact, they get so much hurt of what God has given, except that, in fact, they try to almost always calculate the celebrities, and I should match. I should be like a model. And everybody's one of the most classical example is actually I should be like Katrina Kaif or this lady, and that, in fact, to match that, in fact, if I am not reaching that level, actually I am actually in problem. When we are trying to look at boys and girls, one small message I definitely need to give here, because all the literature points to the idea that, in fact, the male sex in general, boys and men in general, they are much weaker than the females. You may be wondering why actually I am telling it this particular fashion. You look at, in fact, the sperms, there are two types. One is called as the X sperm and another is called as Y sperm. Y sperm for the boys can survive only for 24 to 48 hours. X sperm can survive for 4 to 5 to 7 days. This is one of the reasons why 70% of the pregnancies are first time, if you try to look at is actually the girls. 70% of the natural abortions are related to the boys. People believe that somewhere coming to adolescent, the girls weep and they're actually weak. But that capacity to weep or express emotions or express feelings is one of the extraordinary great capacity. And what actually, in fact, when you try to look at hypertension, diabetes, and 100 other problems, women suffer more in the much later part of the life. But men in general, we are all prone for many of the problems. Coronary artery disease, many times more commonly reported in case of men. All communication disorders, they are all reported in case of men. So the male sex is actually much weaker. And later, we have noticed in many of the houses, women live much longer time than men. Not because of anything, but they waste their life mainly because of the so many other disorders. Also, what we basically talk about, alcohol, drugs, smoking, and many of those other things. Stress can lead to serious mental illnesses too, very minor form of feeling anxious, social anxiety, one may find difficult to talk to people, and much more other things like an obsessive compulsive disorder, repeatedly washing, getting worried about not being clean and adequate. These are all very well reported things. Depression. Women are prone to almost 2 to 3 times more commonly compared to men. But it is a wrong statistics for the simple reason that men too suffer from depression, but unfortunately, most likely it will get masked by what we call alcohol and things like that. Ultimately, when you try to look at, there is a permutation combinations. In fact, depending upon what is actually dominant picture, we try to classify what category of disorders. Depression and depression comorbidities, that means other associated disorders are plenty and one should be well aware of. Nowadays, depression is one of the extremely common problem, and the cat created is actually the loneliness, and that is one of the major common cause for actually the problems what we see in general population in general. So, how to get out of this loneliness is one of the extremely important. We have heard of former suicide. We have heard of suicide by the young people. Many of these type of things are all attributed to this depression itself. Apart from depression, of course, this is a very competitive world. We have not trained them how actually to face stress. This is actually what appears to be one of the major common important areas. Alcohol, drugs, or the other very specific this thing, smoking. All of these things can be highly problematic in your life. Don't go for, in fact, no thanks, no thanks, no thanks. In fact, anybody may say maybe one times, few times can actually lead to become one of the addict. And everybody believes that I am not like others, I can manage life, but it is actually not true because many cases what we see, these are all with this particular high confidence with which they started. How actually, in fact, you try to evaluate when somebody presents faith, you don't find anything problematic. This is what, when somebody is presenting with some problem, nothing actually to explain, These are all the best indicators that actually the individual is going through stress. And stress management, there are multiple ways one can. Taking drugs alone is not the answer. This is what actually one of the important messages. Alcohol, drugs, and smoke, in fact, they may relieve some of the problems for a very short while, but the deleterious and problematic life or chaos they create in your life is something extraordinary. Nowadays, we talk about technology as it has helped in the progress, but all said and done, one of the major common problem for stress is actually this one. Earlier, we used to talk to each other, we used to play, we used to be happy, and we used to share a lot of responsibilities. Nowadays, each one actually works and functions almost like a separate individual. So managing stress involves a lot of things. Eating good, regular, balanced diet, exercise, talk to others, get adequate sleep. These are all very important methodologies actually people have suggested. Vegetarian, non-vegetarian doesn't make much difference. People may talk about, but what is necessary is actually a very balanced, wholesome diet. Eat good food. Junk food is one of the major common problems for so many of the disorders what we see in the young people. Exercise. See, there is a particular chemical release called DHEA, right? Hydroxyethylamine. If somebody does about 20 minutes exercise every day, or maybe at least about 4 to 5 times per week, the DHEA level increases by about 2 to 3 times at the end of 20 to 30 days. What it means is it gives confidence, it makes us happy, and a lot of other beneficial effects actually it can add to our life. But there are 2 more other related mind medicine related aspect actually managing stress. There are many. What actually one can say is your capacity to handle stress, your capacity to handle emotions. In fact, they can go a long way. And how you can do it? That is by learning very proper, adequate social skills. Your capacity to empathize with others. That way you can now manage your life much better fashion. Thinking positively. In fact, not believing in yourself. Capacity to laugh off. In fact, more you feel capable handling this particular thing, in fact, you are that much more happy. You are happy, others are happy. And people have documented the laughter can be one of the best method of actually handling stress. More you become isolated yourself, more you get worried, more you feel upset about, but more actually you are damaging, producing problems. Whether it is the prayer, whether it is like music or yoga, meditation, Tai Chi, or in fact, you can name hundreds of such alternative medical techniques are available, which all can boost your immunity. Not only that, your capacity to manage this. You have to relax, fully relax. How? In fact, again, starting from the yoga to, in fact, in a clinic like ours, we may be teaching about what we call as progressive muscle relaxation. So like that way, there are plenty of methods available to help you. And when you are trying to talk about young people, communicating with them is actually one of the extremely important components. Talk to them. In fact, that's where they can. You are busy and he is left out. That means he has no method to deal with the life, and he speaks to his friend who doesn't have wherewithal to manage this one. That's where actually the whole lot of problem drops. The family. In fact, they can be one of the major stress boosters. In fact, they can improve your immunity. They can keep you happy, and do remember, there is nothing which can be made shortcut as far as this. COVID-19 has produced a lot of difficulty. Keeping social distance and many other things what we are talking about, one should almost always see that you don't get infected. And if you have infection, don't spread to others, and follow all the methods what actually people have suggested. What we are trying to talk about, say for example, wearing helmet while driving the vehicle. Same fashion, wearing mask is one of the extremely important necessary that, in fact, you prevent actually spread. Coming to the sex effect, this is one of the time actually many people have asked us many questions. Use of mobile, a lot many other things are not likely to produce problems. Masturbation, best and the safest method. Reliable partner, use of sex toys, vibrators, no difficulty. Watching pornography, blue sex online. I'm not that we are suggesting you do this actually, but all said and done, they are not COVID-19 related to us actually produced. Watching movies, romantic or otherwise, all of these things should be actually fine. In conclusion, what I can say, I was supposed to speak till 2:45, almost exactly time I think we are reaching. Stress is actually part and parcel of our life. If you know how to kick it out, or where necessary, you are finding it difficult to manage, take the help. In fact, it can go a long way. With these few words, I have spoken in brief about stress, what it is, more particularly with adolescents and how actually they face stress and how it can be managed. I think I will have tried to convey some important relevant information. Being aware of is one of the best way to manage the stress. Negligence or in fact ignorance can be bliss, what people say. It doesn't work with actually managing stress. You have to be aware of. You should have capability and wherewithal to manage the difficulties which everyone is bound to face sometime or other in life. That can make you hardy, stronger rather than weak. With this, I wish you all 2021, which may be totally free from COVID and all good things in the coming years. Thank you very, very much.
Thank you so much, sir. Students, if you have any questions, you can post in the chat box.
Any questions are there, we will be happy to answer.
No questions are.
No questions.
Yes, sir. No
I think
questions
whatever
are
necessary to be conveyed, I think you have conveyed.
Thank you, sir, for addressing about managing stress and to tackle the problems of adolescence. Indeed, it was a very informative session, sir. Thank you, sir.
Thank you very, very much. I convey my thanks to Chandrasekhar, who took a lot of interest reaching me and getting my time. Thank ATME College of Engineering for this opportunity. Thank you.